Well, facts, not fear. We continue our coverage of the coronavirus as it spreads in the United States. New York confirmed several more cases today, bringing the total in the state to at least 11. Overall, there are at least 127 cases across 13 states in the U.S. Health officials say the number of cases include both confirmed and presumptive cases. At least 10 people have died, 8 in Washington state and 1 in California. While there's still no cases in Connecticut, states around our borders have some. Massachusetts, New York, New Hampshire, and Rhode Island are all seeing cases of their own. Thank you so much for joining us tonight for a fact, not fear conversation about the coronavirus. You expect more from us here at Fox 61, and we want to keep you as informed as possible about the coronavirus. Tonight, Brent, Hardin, and I will speak with several leading doctors who will answer your questions about coronavirus, as well as education officials who will discuss the potential impact on your children's education. Joining us first this morning is Dr. Virginia Bielek, who is the Chief of Infectious Diseases at the Hospital of Central Connecticut. Doctor, thank you so much for being here this evening.
Pleasure to be here.
We also want to encourage everyone to write in and ask questions, because we are going to be monitoring some of those and try to ask the various doctors that we're having on this evening. So, first of all, we want to start with kind of a blank slate of the coronavirus. I want to ask how you can explain the coronavirus as best you know it so far. What is coronavirus?
Well, coronaviruses are a large group of viruses that are found in animals as well as humans. There actually are 4 coronaviruses that circulate widely and have circulated widely, and they cause the common cold. And so many people have already had a coronavirus infection. This is a new coronavirus that was recently introduced into humans in China, probably from an animal species. And so none of us have ever seen this virus before. And that's why it's circulating so widely and rapidly.
What's so concerning about the coronavirus? I mean, it's new, so we don't know much about it, right?
We don't know much about it. And again, that leads people, I think, to fear more. We do know that we know a lot about this virus, actually. It's only been around for a few months. We know the genetic material that this virus contains. Scientists have rapidly developed tests that will detect the presence of this virus. Because we know so much about the virus, multiple drug companies are trying to make a vaccine against this virus. So a lot of progress has been made already.
That's good.
It's important to recognize, though, that the vast majority of people who get this virus have a mild illness. And we're hearing about hospitalizations and deaths, and I think that's what people are finding concerning.
Yeah, and we've been hearing about that what, 80%, I think someone threw out that number of people who get the virus. They're not very severe, that you can survive it if you're healthy and you're in good shape, then most likely you're going to be just fine. But it is those cases of people who are elderly or might have other health issues that are being compromised here.
Absolutely.
Okay, yes. So let's get to some questions. We went over to Bradley International Airport today to ask people what they would want to ask a medical professional, give them the opportunity to do that. Here is what one woman passing through wanted to know.
My biggest question would be, what is the best way to protect myself and my family?
Okay, this is such an important question, and it's what everyone wants to know at this point.
Yeah.
So tell us, Dr. Bielek, what we can do.
Well, first of all, hand washing. If you can't wash your hands, and I'm talking 15 to 20 seconds, hand washing, an alcohol-based hand sanitizer is next best, but do that frequently. Before you eat, after you use the restroom, just because these viruses can be transmitted from a surface and they get on your hands, and then you can put them in your mouth or your nose or your eyes. We're always touching our face without realizing it. So hand washing, hand sanitization. The term social distancing has come into play here.
Okay.
And so if you see somebody who is sick and coughing, stay at least 6 feet away from them.
Okay.
If you are sick, stay home and don't infect other people. cough or sneeze into a Kleenex and discard that Kleenex right away. If you don't have a Kleenex handy, cough into your elbow, and just try to protect the public. But hand washing, also right now in Connecticut, if you have fever and respiratory symptoms, it's more likely you have influenza. So get your flu shot. Try to stay healthy.
Yeah, it's not too late to do that.
Not too late.
I mean, I
yeah.
know a lot of workplaces. I was talking to my mom, her school, everyone's sick. Our newsroom, I mean, we've had people calling out just because people are sick. You know, we've been sanitizing and everything like that. But this is something that a lot of workplaces, a lot of schools are dealing with right now is influenza.
I think this has brought to the forefront the importance of staying home when you're sick and trying not to infect your coworkers and other contacts.
It's hard for Americans to do that. We have a very high work drive and we all want to come in. Okay, here is another comment from someone at Bradley.
Have you ever considered putting on one of those masks?
You know, yes, actually, but I've heard it's like if you're sick, wear it. If you're not sick, you could still maybe catch it.
All right, so that's Danny that we talked to at the airport. This has been a huge question, and we know that masks have been selling out online, and there's some mixed messaging about whether you're supposed to get that or not. I know we want to have enough from medical professionals, but is it even worth getting a mask?
Well, it's probably not worth running around with a mask all day. A surgical mask may not protect you well. The front of it may get contaminated. You touch that front of the mask and then you touch your eye. So it may give you a false sense of security. If you are sick, wearing a surgical mask may help prevent your infecting other people. The respirators, which we are wearing in the hospital should we see a patient with COVID-19, they're actually pretty hard to breathe through, but they may afford more protection. But again, we do ask the public to not go out and buy those because we're going to need them to help take care of patients. And they're probably not going to do you a whole lot of good because, again, the front of the mask can get contaminated. You touch it and you can actually spread the infection that way.
That is a really good point.
Yeah.
And that's something I haven't heard also on the other end of it, where it's like if you're healthy, that's not necessarily effective, but if you're sick, it might help contain it a little bit more.
It might.
But we're still not encouraging people to go out and do the masks. You're saying hand washing is really the key right here to disease prevention at this point.
And staying away from somebody who is sick.
Now we have learned the footage that you need 6 feet. People, I know you need 3 feet of personal space to feel comfortable, right? 6 feet if your coworker is not feeling very well.
Absolutely.
Okay, so I think we have another piece of sound, an interview that we did that we can play. This should be Veronica. Let's listen.
It's a virus, and we've seen viruses before. We don't know what this one is, but we've seen viruses. So if you can stay away from the flu, you can probably stay away from this.
Okay, so we just touched on this a second ago, what Veronica was saying, and is that the gist, that if you're the same prevention that you should be doing for the flu, you could do for coronavirus?
Absolutely. I like Veronica's thinking. It's common sense. And again, coronaviruses they've infected all of us. It's just this one is new, and we're still learning how often it kills people. There's still a lot to learn about it, but Veronica's right.
Yeah, and again, the flu, pretty rampant right now in our state. Okay, so I want to encourage you all to continue writing in. We're using some of the questions that we had asked and gotten on Facebook and social media throughout the day, but we are streaming this live on Facebook right now. So write in, send us your questions. We have gotten a few more here that I want to share. What's the best way to clean surfaces that are touched often by a lot of people? Are Lysol wipes appropriate? Do those do the job?
Great question. Yes, your usual disinfecting wipes are a great idea. You should be wiping down surfaces such as doorknobs. Any frequently touched surface, wipe it down frequently, and that will help also.
Elevator buttons are important in workplaces. Everyone's touching that. Okay, and a bit of a personal question here, and for other expectant moms. We know that an illness like SARS was deadly for pregnant women. What do we know about coronavirus and people who are pregnant?
I don't think we know a whole lot yet. I haven't seen a whole lot written about that. In general, though, young people do better with the coronavirus than older individuals. So, we're hoping it's not going to be any worse in pregnant women, but influenza can be worse in pregnant women. So I think the data are still out there, which makes, if you're pregnant, it makes social distancing, staying away from people, washing your hands frequently even more important.
I know a lot of us in the newsroom as well, also our hands are just so chapped. No matter how much lotion you're putting on, you're cleaning your hands so much that your skin can't fully take all that,
Common problem in healthcare workers.
Let me know. I'm sure.
Yeah,
if I have a solution, I don't know, Keith's hands, I've heard. That's apparently it. Okay, thank you so much, Dr. Bielik. It was a pleasure chatting with you, and I love that you lend your expertise for us, because again, what we're trying to practice here is facts, not fear. We want to bring you guys, information that's not hyped up and that you can use to protect you and your family, but one that is tempered, and know that we have incredible medical professionals here in our state that are ready to tackle this for when it does come. All right, so right now we want to send it over to Brent Hardin, who is joined by more healthcare professionals who will answer questions that you asked us on social media. Hey, Brent.
All right, Jen, thank you. I'm joined now by Dr. Stephen Wolf, Chairman of Emergency Medicine at St. Francis Hospital, and Dr. Jessica Abrantes Figueredo, an infectious disease doctor at St. Francis. And first, I want to ask the both of you, what is your hospital doing to prepare for the eventuality of coronavirus coming to Connecticut?
Great question. I think we probably both can answer too, but in our hospital, we've just with the CDC guidelines, we've come out with a hospital preparedness plan. We have a specific core COVID-19 group. In part, Dr. Wolf is on that team, as well as myself, some other infectious disease specialists, and we're meeting weekly. We're providing education to our staff. We're making sure that we're ready to accept patients, counsel patients, and deal with patients that come in, whether it's through the ER, through our outpatient clinics, to, again, like your title is, spread facts, not fear, and, not be panicked, but just prepared.
So far, there's not been a state here in the U.S. that's been seeing the kinds of infection rates that they've seen in Wuhan, China. There are thousands of people there. Here, it's been really a trickle by comparison. But in the eventuality that the numbers would get greater, is your hospital, and do you think other hospitals would be prepared for an influx of large numbers?
Well, we're always dealing with infectious diseases, so this isn't much different in terms of what our normal processes are. As soon as someone who's infectious is identified, and right now we've got screening questions and symptoms to look for, they're immediately isolated. So that's no different than what we do. We wear protective gear. We mask all patients with any kind of respiratory illness, whether it's the flu season or not. So all of that is in place already. The problem will come in if high numbers occur, and we'll have to deal with it when it becomes such a high number. The isolation issue becomes more moot because everybody's got it. So it really, the trick now is to really do as much infection control as possible to limit the spread, keep the numbers as low as possible.
That's what I was going to say. There are a lot of efforts being expended right now to make sure that never happens. Hopefully they'll be successful. To get down to the basics here, and if there is a way that a layperson can understand the question or the answer, what's the difference between a virus and a bacteria, and why are viruses so much harder to kill?
So viruses are just made slightly different than bacteria. The big thing is that, antibiotics versus antivirals, and then there's just not as many, medications for viruses, even with the flu having only several drugs and it not necessarily being as effective. And usually those, what we use to treat viruses, it's really just to help spread, decrease duration of symptoms, whereas with bacteria, we're looking more for curative and to really eradicate the infection, whereas with viruses, a lot of it is time.
Mm-hmm. Okay. We got a comment on our Facebook live stream just a few moments ago from Gina Marie, and she's asking, is it true that most of the deaths have been in the elderly? And I think that is not true, is it?
So actually, most of the deaths have actually been in older population and those with comorbid conditions. So those are, it seems to be the highest risk population right now to become.
And so, I'm sorry to interrupt, but so people understand what we're talking about here. When you say comorbid, meaning that they have some underlying health issues already.
So some other underlying health issue, So they're not completely healthy. They may have cardiovascular or heart conditions, lung conditions.
Okay. We talked to Dr. Bielik about this just a few minutes ago, but I wanted to drill a little deeper here. We talked about the importance of washing hands early and often, but also the use of hand sanitizer if washing with soap and water is not available at a particular moment. So hand sanitizers are effective as long as you get the proper kind?
So typically, hand sanitizer with at least, most hand sanitizers have good effectiveness. The key is actually using, a good dime size, usually not skimping on what you're using, and making sure that you're actually washing and, scrubbing it into your hands. And again, frequency as well, so multiple times a day.
I've heard of people making their own homemade hand sanitizers. I'm not sure how you would go about doing that, but if people are tempted to do that, what would you caution them to do?
I haven't really heard about that, but yes, probably don't, and probably store-bought hand sanitizer. I don't think there's any specific brand, but yes, the hand sanitizers, in lieu of washing, if you can't wash your hands, would be a good idea.
But the hand washing is the best.
Absolutely.
For 20 minutes, not just a little quick
Seconds.
rinse. I mean, 20 minutes, 20 seconds. 20 seconds.
People might be tempted to go 20 minutes right now
Maybe.
anyway. But
yes, 20 seconds.
And not to get too technical about this, but the temperature of the water, does that matter?
Not really. I mean, hot water obviously will kill germs, but you obviously don't want to burn yourself. So really, it's the physical action of washing. Wash the fingertips. A lot of times people don't think about that, so you want to kind of really rub and do it in between your fingers. I sort of advise people to rinse and wash, rinse and wash, and rinse and wash again too.
And again, as people move through public spaces and they walk down the stairs and put their hand on a handrail, or they walk through a door and they put their hand on the bar or the doorknob, should people wash their hands every time they touch something, or can the germs live on metal surfaces like that?
It certainly can. So, I mean, you probably can't wash your hands or use hand sanitizer after every single, touch. But that's the whole point, like Dr. Bielik had mentioned, with multiple times a day hand washing. If you just think about all the times you're touching a surface that other people may have touched, doorknobs, someone mentioned the elevator, tables. So unless those are also being, continuously washed down too, which they should. So even at home, people should be high-touch surfaces washing down. But yes.
Okay. And when people blow their nose,
Absolutely.
and they should be, after they do that, they should sanitize their hands, because everything they touch then is just going to infect other people.
And they talked just a minute ago, Jenn and Dr. Bielik talked just a moment ago about 80% of the people who have come down with the coronavirus infection experience a very mild illness, but that in itself is making it harder to stop it from spreading, correct? Because people get a mild illness, they don't necessarily go to the doctor and get diagnosed.
Correct. And that's where the difficulty also comes in terms of how deadly it is, because we really don't know the total number of cases that people have, and so it's hard to really estimate what the virulence is.
Is it possible? I mean, should people start maybe going to doctors anytime they get a sniffle?
So we'd probably advise against that. And the CDC has come out with guidelines too that, yes, if you have respiratory symptoms, you should certainly call. You can certainly call your physician, but you shouldn't necessarily be running to the closest ER. And then what happens is it might bombard the ER room visits. So a lot of times we're now looking more towards possibly having patients call and being screened through the phone to see if they need to come into the clinic and be seen.
Okay, quickly, let's go through the initial symptoms, and then as they begin to get worse, what might coronavirus feel like?
So honestly, it's like other coronaviruses, other viral infections, but fever. In this case, a lot of it is lower respiratory tract symptoms. So not all people will have the runny nose. So cough will be prevalent, shortness of breath. A lot of people, like we've talked about, have minimal symptoms, and patients, that progress may start to have worsening respiratory illness, so extreme shortness of breath, obviously needing medical care.
Okay.
Very little GI symptoms,
Right.
apparently. So it's really all respiratory, cough, cold, that
And the
kind
fevers.
of thing. And fever, like the flu-ish, just flu symptoms.
All right, so we did ask people on social media to send us the questions they would want to ask, and we got one from Cindy King, who's asking, I'm supposed to travel to London in 3 weeks for a pleasure trip. I was wondering if I should reschedule. Those planes are so germy, she writes, and they are, and this is a very common question right now. What's your advice?
And I think planes right now may be so germy as they were before coronavirus as well. So I would say, especially since England is not one of the hot spots right now, or have any travel bans or anything like that, that would probably be okay. But you should do safety precautions that you should have done even before the coronavirus. Hand washing, even throughout the airport, high-touch surfaces, having hand sanitizer with as well, covering your cough, things like that.
Okay. All right. We got a question from Lawrence Labate. He wants to know about the test to determine if you have been infected. Dr. Wolf, would that happen in the ER?
Yes. At this point in time, hospitals don't have the test, so it's really the state health departments that now can do it. Before, not actually. Just last week, I think we were pretty much sending it to CDC. So it's really now some of that is being rolled out to the health departments. The hope is that the tests then could be rolled out to individual hospitals, because that will cut down the turnaround time significantly, and then we'll be able to discharge patients and free up rooms for the next ones.
What is the turnaround time right now?
Difficult. It's at least a day, and could be longer depending on the state and the facilities.
Okay. Melissa sent in a question. If I should be preparing, what do I need to make sure I have in my house?
So, typical things, it would probably be what she may be, implying at is some people are being asked to be quarantined. So if patients come from, certain countries right now, if they're screened at the airport, they may be asked to be quarantined. The same thing with healthcare providers, coming back from certain countries. So honestly, if the quarantine is for 2 weeks, technically one would say maybe having enough food supply for that. Again, we don't want to spread panic. The majority of patients, or the majority of people, would never need to even be quarantined, but just having household products that you would need regardless on a daily basis.
What about in the case of people with prescription medications that they're taking? I suppose it's possible to simply call the doctor and say, I'd like to stock up a week ahead in case we all get quarantined for a while. Would doctors do that for them, do we suppose?
Well, I mean, you can get most pharmacies now deliver to home.
Yep.
So if you're stuck at home, I can't imagine those arrangements can't be made to ensure that whoever needs to be quarantined stays quarantined.
All right. Dr. Wolf, Dr. Abrantes, thank you so much for joining us. We really appreciate you being with us here tonight. We want to send it back to Jenn now, who is with the doctor, who will answer some more of your questions. Jenn?
Really interesting information, Brent. Thank you so much. Joining me right now is Dr. David Bannock from UConn Health to answer more of your questions from social media. Thanks so much for being here again.
Thanks for having me.
I know you've been in our studio several times this week, and we appreciate your time so much. First, we have a question from Louis Gaston, who wrote in on our live stream just a bit ago. How can people boost their immune system? Deddy Martinez also writing in, and a few others on our Facebook Live, wondering also what the risk is for people with asthma.
Okay, so both very good questions. So in terms of boosting your immune system, the most important thing is to try to maintain as healthy a lifestyle as you can. So that includes things like eating a varied and balanced diet, keeping up with your nutrition, physical activity can help you stay strong. One thing that's really important is if you do have chronic medical conditions, to really do what you can to try to control those as much as possible. And that's where things like asthma come into play. So patients with asthma, or individuals with asthma, are at more risk for getting complications from respiratory infections infections, but really keeping that asthma under control as much as possible with medications or other lifestyle measures can be protective in some ways from developing those consequences if someone were to get infected who had asthma.
So this is not a good time to not take your medicine.
Exactly. Yeah. No. It really hones in on the importance of taking your medications, keeping up with your routine health in order to try to protect yourself.
Okay, we have another question here. Jerry is wondering, are there any precautions that we can take to stay healthy, which you kind of just answered? I do want to bring this up as part of this question a little bit, because tonight we got an update from the Hartford Archdiocese, and they were just talking about how they were going to try to handle the coronavirus. Church is certainly a place where people are coming together, and you have people, the sign of peace. You have people taking communion, and they're saying things like the sign of peace should be exchanged without physical contact, like handshaking, or else the call to exchange a sign of peace should be simply omitted. Communion on the tongue should be strongly discouraged, and there should be minimal handling of collection baskets by ushers only, and then, of course, hand washing. These are good tips, I would assume, for churches.
Yeah, and I think that's really good general advice when it comes to infection prevention. So we know that droplets like coronavirus can be transmitted either from person to person, but also through surfaces that are shared. So being careful with touching other individuals, and then touching your face or touching your mouth. So washing your hands between any contact with others and before you touch your mouth is something that would be a nice precaution to take. And then touching shared items like you were describing, something to try to avoid as much as possible. But that's general guidance when it comes to any sort of respiratory infection prevention.
It's so hard with our culture, because even when you all are coming in tonight, we all want to shake hands because that's our normal greeting, and to show of appreciation for you all being here. I know we were all like, fist bump, or I know the U.S. General or the U.S. Surgeon General who was in Connecticut today, or not today, this past week, was saying to bump elbows, but important at this juncture.
I agree. I think those are the kinds of things that are not a part of our typical culture, but may be beneficial in terms of preventing the spread of organisms between people.
Dr. Bannock, we were just talking about this before. We don't know how long the virus stays on surfaces, but you had some information on what we think, how long we think it lasts.
I mean, I think the information that we know about this coronavirus is based on what we know about other coronaviruses. So in a category of coronaviruses, they don't last for really prolonged periods on surfaces, potentially minutes, hours. There's no evidence that there's long periods of time that they stay on surfaces. And the question comes up a lot about packages coming from parts of the world where there's a lot of coronavirus activity, but there's no evidence to suggest that they can stay on inanimate surfaces for really prolonged periods of time like that.
Okay, so if a package was coming from China or something, you really shouldn't be worried. Should be more worried about it being handled in the U.S. maybe and brought to your door.
Exactly, and think about shared surfaces. So touching a counter, touching a table that a lot of people are in contact with. If there's any doubt, after you touch it, try to wash your hands before you're going to be eating or touching your face to prevent introducing virus into your body.
Okay, and again, just want to remind you all to write in your questions, because we have people standing by right here to answer them. We have your comments scrolling on the screen behind me, so we are watching them. We have Alana right now, one of our web folks back there, watching everything that you guys are doing and trying to get those questions to our health professionals. Let's get to the next one here. Julie asked, with the reporting that it looks like to many like a cold or even looks like bad seasonal allergies, how is the average person to know if it's a cold, bad allergies, or coronavirus?
That's a good question. We see a full spectrum of illness, from very, very mild illness to patients who feel some symptoms, get pretty sick, and then, of course, in rare situations, very ill individuals from coronavirus. Some things to look for: if you start to have high fevers, if you start to have any coughing, difficulty breathing, that would tell you that it's more than a common cold, more than allergies. Those kinds of symptoms would make you think about potential virus infection. Unfortunately, a lot of the symptoms do overlap with the flu, so that can be really difficult. So scenarios that we often encounter are patients who come with a situation that's not clear if it's coronavirus or the flu, and we have to look both in terms of their history of what they might have been exposed to, and then also thinking about actually doing a test for the flu, which can be used to diagnose that.
And right here in Connecticut, we have a lab, a state lab, that is now able to test for coronavirus. It's in Rocky Hill. It just got approval from the CDC this past week, because before what they were doing is they were having to you would have to send the test to the CDC and then get confirmation, right? So this is like a 24-hour test, right away.
Right, that's actually an important advance, because the time delay used to be pretty significant when specimens had to be sent down to the CDC. But now we do have them at the State Public Health Laboratory in Rocky Hill. We have testing available. The Public Health Department is very involved in terms of deciding about testing practices and guiding clinicians on testing practices, but it's really that close relationship between the Department of Public Health and clinicians that help make that decision.
All right, next question here. Roy Yolanda wants to know, is it airborne? This is a great question, and I know a lot of people are concerned about that.
Yeah, that's a really good question. So what we know about coronavirus is that it is transmitted through droplets. So that's distinguished from airborne transmission, which we think about things like tuberculosis. Those kinds of organisms can travel very long distances in the air, whereas organisms like coronavirus are much larger. They don't travel as far, so that 3 to 6 foot distance is what we describe for coronavirus in terms of how far it can travel in droplet form.
That's very interesting. I didn't realize this. So what's the definition of airborne then, where it just literally travels through the air and not through larger droplets?
It's based both on the size of the particles, but also how much distance they can travel. So airborne organisms can travel for longer distances.
Wow, okay. And again, coronavirus is not spread through that way, as you were saying. Tuberculosis was, it's more through the droplets. So as Dr. Bannock was just saying, and Dr. Bielik before was saying, 6 feet personal space is good to stay away from people who are sick. You agree with that statistic? Okay, so the other thing that I want to touch on off of that is that the CDC brought out some new guidelines, I think today, for people who are traveling to the impacted countries. Why don't you share that with us? Because this is definitely a change.
It is. So the CDC has really been keeping a very close eye on coronavirus activity throughout the world. And there are some countries that have very high levels of coronavirus activity. And the CDC has been issuing travel recommendations to avoid non-essential travel. And now most recently has issued guidance as far as what to do if you come back from one of those countries. And the recommendation now is to essentially stay home, avoid public spaces, really, and also keep a close eye on your symptoms. If you start to develop any fevers, to contact your health provider and discuss the next steps.
And this is different from before. We're talking about specifically the CDC. I was reading this today because Governor Lamont had sent out a note. The CDC recommending if you travel to Iran and you're back, China, Italy, there might have been one other country on there.
I believe South Korea is
South Korea, yep, that was the other one. That you should self-quarantine for 14 days, even if you're not showing symptoms. So before, if you were showing symptoms, you really needed to self-quarantine. Now, if you're coming back from there, they want you hunkered down for a little while.
Exactly.
Okay, all right. Going off of some of the stuff we talked about, what specific symptoms, this is another question we got, should people be most worried about? We touched on this a little bit. But.
We did. So, as I mentioned, a full spectrum. The key symptoms that you want to be looking at, fevers, worsening breathing, coughing, that's the classic respiratory symptoms that we see that we really want to be on the lookout for. But it can be a range. If you have any doubt, really calling your physician or your clinician and discussing with them to decide what the next step should be would be the best way to go.
Okay, here's another question. If someone does get sick, what is the treatment?
So the treatment at this point is supportive care, the same kinds of things that we do with other respiratory infections. So really staying home, managing the fevers with even things like over-the-counter Tylenol, keeping up with your fluids, that's a big one. Dehydration would be a concern. And then ensuring that your breathing status is okay and taking symptomatic measures. There's several over-the-counter cough medications if that becomes an issue. But if you notice that your symptoms are worsening, really an in-person evaluation or a reevaluation would be needed if you've already been seen.
Okay. A Facebook comment here just caught my eye while we were talking, and I want to ask that because I know you guys are streaming in right now. Kim Gavel wants to know, can our pets contract it? There's a lot of questions about this, whether a dog contracted it in China or not.
Yeah, that does come up a lot. At this point, we don't have evidence that that's the case. There is concern that the origins of the virus, where we think it originated in China, was through an animal vector.
Yep.
We don't fully understand exactly how that occurred, but that's the suspicion based on the epidemiologic investigation. But at this point, we don't have evidence that pets are a vector of spreading the virus.
Okay, I have another one for you here. Christine Connell wants to know how many people have contracted and survived. She feels like we haven't heard a lot about that necessarily. We're hearing a lot about the people who have died from the virus because, of course, those are human lives, and it's a big deal when someone dies from coronavirus, but most people survive.
Absolutely, and that's really critical. A very small percentage of people actually even get sick enough to need to go to the hospital. That's really just the very tip of the iceberg. There's probably more people than we know about that have an sort of acute self-limiting illness and recover on their own.
Mm-hmm.
A lot of those patients don't even get tested. So I think we hear a lot about the patients that had really serious illness, and including those who died. But that's really a very, very small minority of all the patients who have an infection.
Okay. One more question that I think is important that also just caught my eye while I was listening to you. Patty wants to know, should we look carefully at food packaging if it's from China? So
another question that comes up very frequently. I think that goes back to some of the thoughts that some of our understanding of virus survival. We don't have evidence that the virus would survive for like very, very long periods of time like that. For something to be shipped in from China would really be quite an extensive amount of time. Plus a lot of temperature changes also, which probably wouldn't be supportive of the virus surviving. So I think we don't have any evidence that that type of transmission is occurring.
Yeah, and it's important to state this too, because I know some business owners in Connecticut were having trouble this week. People who own Chinese food restaurants were actually having to come out and say, no, you're not going to get the virus this way. I mean, that's pretty obvious, but people get scared. And so it's important to state that today, too, that you're not going to contract coronavirus from going out and eating Chinese food at a restaurant.
Yeah, that's really important to stress. I think there's a lot of misunderstandings about that, but I think that there's no concerns about that type of transmission.
No. Okay, so last question here. We mentioned this before, vaccine. How far away are we from a vaccine?
Tough to say. I mean, I think, there's been a lot of enthusiasm for a vaccine.
Mm-hmm.
We've had vaccines against other respiratory infections, and they've been really important in preventing infection. But the development of a vaccine can take a long time. I think one thing that we're really at an advantage with in 2020 compared to things that have happened decades ago is that we have the ability to get genetic information very quickly about the virus, and that helps us facilitate the development of things like testing and also vaccines. But in reality, the vaccine process does take a while. It involves several steps, not just the development of the vaccine, but testing the vaccine, ensuring it's safe and effective, and that is a process. So, I'm optimistic that in the future we'll be able to have that, but in the near future, I think we're going to have to focus on other measures.
And we know that one company here in Connecticut is even trying to develop that vaccine, but as you said, it can take up to a year, which is good in the future. But not necessarily right this moment. Important work, though.
Absolutely.
Dr. David Bannock from UConn Health, thank you again for coming in and chatting with us. And a reminder here that we're trying to get down to facts, not fear. So important as we go through this stage. Okay, we're going to send it right back to Brent, who has another angle on our facts, not fear coverage. Brent.
Thank you, Jen. And that angle is your child's education. It's a concern for a lot of parents in the state here. If the coronavirus outbreak does make its way here, what will the Connecticut schools do? So joining me now is Patrice McCarthy, Deputy Director and General Counsel of the Connecticut Association of Boards of Education. Big breath, that's a long title.
Yes, it is.
Thank you for joining us. I guess the first question is, how are schools preparing?
They are looking at policies and procedures that they already have in place. Mm-hmm. We have our policy expert on staff who actually spent one day last week updating those policies. We're making those available. And those deal with all sorts of emergencies that can occur in the school building, including the protocols around good practices for a safe and healthy school environment.
These are folks who deal with the flu every single year in the schools, and so these protocols are going to be very similar, I would assume.
That's right, and it's really a heightened attention to this, communicating with families to remind them that if their child doesn't feel well, that they should stay home, good practices around, we've heard a lot about washing hands, cleaning surfaces in schools, because you've got a lot of hands that are touching things there. And all of that will really help prevent and mitigate the spread of the flu or the coronavirus.
And as some parents are aware here in the state, we do not use bleach in the schools. What are they using instead to clean up?
We have legislation in Connecticut that requires the use of green cleaning products. Better for the environment, probably better for individuals that come in contact with them, and those are as effective as bleach is. So they should be used on a regular basis. That's really what's going to make the difference for health.
It's the good stuff.
It is.
It's the good stuff. Is there a specific state agency in Connecticut that's taking the lead on this?
In terms of communicating with school districts, the Connecticut State Department of Education has been doing an excellent job. They have on their website a banner that links to information from the CDC as well as the Connecticut Department of Public Health. The Commissioner of Education is convening weekly meetings or conference calls with all of the statewide education groups so that we're able to share questions and he is able to share information that his staff has obtained.
So what's your message to parents, and for that matter, the students and the teachers, all the people who congregate in schools every day? How concerned should they be at this point?
If they are following the basic protocols to keep themselves safe and healthy, they should not be any more concerned, really, than they were 2 months ago when we faced a regular influenza season.
All of the efforts right now, and we're talking about health officials all over the country and really all over the world, we're talking about political figures all over the country and all over the world, all of these efforts are aimed at preventing widespread spread of the coronavirus and coronavirus infections here in the country. So we hope that that doesn't happen. In the event that there were large numbers of people and it might become necessary to even close schools for a few days, what are the plans being discussed right now? And is it feasible for kids to essentially attend school from home on, say, a laptop?
Well, there are really two parts to that question. The decision in terms of closing schools would probably be made on a school-by-school or school-district-by-school-district basis based on the advice of the health professionals. Just as superintendents get advice about closure for weather conditions from Public Works and local police, the local health officials as well as State Department of Health and CDC would be advising schools about the advisability of closure. Our districts are in a variety of places in terms of the ability of their students to do online learning, for example. Some of our students don't have internet access in their homes, so that there's an equity issue there. There certainly is the opportunity for students to go home with extra reading materials, things that they can reinforce learning that they've already had. And that's one certainly option that a number of districts are looking at.
Okay, is there a central clearinghouse for information that parents can go to if they have questions?
I would say the information on the Department of Public Health and the CDC website provide that general information, but individual school districts are also communicating with their parents and families. And that really, for parents and guardians with children in the school, that's the best source of the information that will really apply to their son or daughter.
All right. Patrice McCarthy of the Association of Boards of Education, thank you so much for joining us tonight. We appreciate you coming in. Good luck to you and all the educators in the state and all of us, really. And we want to thank you for joining us for this special live coverage of the coronavirus outbreak. We hope we've been able to answer your questions. Be sure to send us along any other questions you might have. We'll be in continuous contact with medical professionals and other experts who have joined us tonight and more, and we'll do our best to get you the information you need. Have a good evening and join us later for the news at 10 and 11 here on Fox 61.